Welcome to DCA TV. I am Jennifer Erickson, your host for today's show. Today, we will be speaking to Dr. Fallah, a dentist in San Diego, California. Dr. Fallah has a background in biochemistry. He earned a degree from UCLA Dental School, where he ranked in the top 6% of the nation on his national board examinations. These and a long list of other credentials and professional affiliations make Dr. Fallah uniquely qualified to attend to the dental needs of patients throughout the San Diego area at his practice in Carlsbad, California. Dr. Fallah applies background in biochemistry, in-depth training in specialized techniques, core nutritional principles, and a wealth of clinical experience to further the oral health and overall wellness of patients in the San Diego, California area. At the holistic, reconstructive, and cosmetic dental practice of Dr. Fallah, each patient's oral health, whole body wellness, and satisfaction in the appearance of the smile is always top priority. Welcome, Dr. Fallah. It is an honor to be with you today.
Thank you. Pleasure is mine. So I am a dentist, a biological dentist. My practice philosophy is to do comprehensive dentistry within the framework of oral systemic health. Our goal is to maximize the health of patients' mouth and addressing the needs of our patients through providing the best possible care we can in the framework of maximizing patients' oral systemic health. For example, we address, I'll start with a very small part of what biological dentistry can be, and we can talk about different aspects of it. For example, let's just take a small cavity. And the cavity, when it's getting closer to the pulp, we would address that cavity with things such as ozone and other antimicrobials that will kill the bacteria and the microbes within the cavity. And then we would fill the cavity with a biocompatible material that would look good and actually be lasting and also compatible with the patient's biology. And in doing so, we do everything we can to prevent root canals, infections, and that's just a simple approach to tooth decay. We believe that preserving the vitality of a tooth or teeth is critically important to the health of not just the tooth, but the whole patient. Because anytime there is any sort of low-grade infection or beyond that within the mouth, that infection percolates through the lymphatics in the bloodstream and through the environment around the tooth and the gum tissue, and it affects the patient's health as well. So addressing the health of the oral environment is our primary focus. When we are dealing with, for example, infection, if a tooth is already infected and it's beyond saving, when we remove the tooth, we address the infection, make sure that all the infection is cleaned up. We can use oxygen ozone. We remove the infected tissue, whether it's the soft tissue in the bone. We use very high-tech equipment and techniques such as use of laser, piezo, ozone, and we then use patients' own blood in the form of platelet-rich fibrin, which creates a matrix for healing, and from that matrix, new cells, new bone cells, and new gum cells develop, and in doing so, when the area heals, it heals properly without any residual infection. And if we need to go in there and place a replacement tooth, we use a biocompatible substitute such as zirconia implant. Zirconia implants are made of zirconia oxide. They have no metallic signature, and they are extremely biocompatible. The gum tissue attaches beautifully to it. The bone integrates beautifully to it. And we see phenomenal results with that. And when we're restoring a tooth, we use biocompatible materials such as biocompatible composites or porcelain materials that would be appropriate for the patient's health and function. So whatever we can do to maximize the functionality and health through our approach with the teeth, gums, and the bite, we would address that. Another thing that we do that's very unique and special is when we're addressing the bite, we make sure that the bite is very thoroughly balanced. We use a technique with T-scan, which assesses the bite in the way that we make sure the forces are distributed appropriately and equally between the right and left, front and back. And that's critically important in terms of the feel of comfort, in terms of the cranial stability and other structural relevance that the bite can have, the impact of the bite on the rest of the body.
Great. The next question, how does holistic dentistry go beyond ordinary dentistry?
Well, there are many aspects to holistic dentistry. Like, for example, one of the things that as a holistic dentist we do is appreciate and realize that we don't want to expose our patients to any mercury vapor or any of the byproducts of amalgam. So for example, when we are removing an amalgam filling, which is 50 to 55% of it is made of mercury, not only we place a rubber dam and clamp on the tooth or teeth that we are working on, but we place a micro seal which completely eliminates the seepage of any fluid into the oral cavity. So in essence, we are completely isolating the environment where the tooth that we're working on from the rest of the oral cavity. And so we essentially make sure that we don't get any seepage of that debris into the patient's mouth. And at the same time, a patient is going to be breathing through an oxygen mask, and so the patient's not inhaling any of the mercury vapor either. And myself and my staff, we have special masks, and we have multiple high-speed suctions that are operating in the treatment room, and that helps everybody to stay safe. And so that is one aspect of how holistic dentistry is different than conventional dentistry. In fact, about 20 years ago, I had many of my amalgams removed unsafely, and I was suffering from fatigue for a number of months, and one of my physician friends tested me and found that that was very high in mercury, and that was the beginning of my journey towards holistic dentistry, was through my own personal experience. So being mercury-free and mercury-safe is really, in my opinion, the very first step of being a biological dentist. The other aspects would be using materials that are compatible with your biology. Like, for example, we do a test that's called Clifford or Biocom. We have two different companies that do the testing. And either one of these companies do a blood test where we would know, they would actually test to over 500 of dental materials from the blood sample that is provided to them through patient's own blood. And that would tell us and the patient what materials that patient is sensitive to. And so we would stay away from those materials. And believe it or not, it's not always the same for everybody. Not everybody is compatible to the same exact thing. And we know that especially through the blood biocompatibility testing. So that's the second part of that. And the third part is really appreciating that the oral cavity is a dynamic environment. We want to make sure that we eliminate infections and we promote health. And that would be through addressing, just as I said earlier, cavities with laser, ozone, and biocompatible filling techniques, to extractions that are done in a way that would promote healing, to replacement protocols that are courteous to the body's biology, to addressing the bite and making sure the bite is balanced so it's not affecting patients' head and neck in an adverse way. And so it just has many layers to it. When we are doing grafting for the gum tissue, one of our first choices would be patients' own blood product we call platelet-rich fibrin. So I'll do the blood draw and we'll spin it and we separate the fibrin and the growth factors, and we use that as a primary graft material. If we need to do bone grafting, for example, we use either the platelet-rich fibrin, advanced platelet-rich fibrin, which has bone morphogenic growth factors in it, or we use bone graft material called Steiner bone graft material, which is calcium triphosphate matrix with no antigen. So we don't use cadaver bone, or we don't use the bovine bone, and we stick to products that enhance healing without creating any immune reaction. And so these are some of the examples of how biological dentistry takes things to a different level, in essence.
What are the benefits of zirconia dental implants?
Well, the zirconia dental implants are truly beautiful. There's no grayness to it. The tissue, the gum tissue attaches to the zirconia implants without any sort of inflammation. The crown that goes over it has a natural background. So the aesthetics of a tooth that's restored with a zirconia implant is night and day more beautiful than a titanium implant. A titanium implant has that grayish look. So several things that we see in terms of the difference. One, that titanium with time oxidizes, so you get titanium oxide. So as the patient ages and let's say the gum recedes, that titanium oxide actually becomes, because it has a porosity to it, attracts bacteria and plaque, and so it can lead to peri-implantitis, which is inflammation of gum around an implant. We do not see that with zirconia implants, which is partly because there's no oxidation process. It's a crystalline structure. And so that's really important. And from a biological standpoint, the zirconia oxide is a crystalline structure. It's not a metallic substance in that sense. And so called signature to it. So if you use a voltmeter, such as a reader machine, for example, on a zirconia implant, you don't register a voltage, as opposed to a titanium implant, you can register voltage on that. The most obvious part is that it just looks so much better. That's a big advantage in terms of, especially when it's your front teeth.